Hey, thank you all for being here with us today. I'm Alicia Duquara. I'm the Executive Director here at Get Healthy Utah. And then I'm here with Morgan Haddon, who is our Program Coordinator at Get Healthy Utah. And so we'll be switching off back and forth today, so you don't get bored of either of our voices. Have a nice balance between Morgan and I to talk about our report and findings from the assessment that we've worked on this past year in relation to public health policy work. So we're going to go ahead. We have a lot of information to cover, so we're going to go ahead and dive in, and you're welcome to put questions in the chat, and we'll also have some time at the end for questions. So I'll turn it over to Morgan to get us started.
Perfect. Thanks, Alicia. And thanks everyone for taking some time today to hop on this webinar. Hopefully it can be really helpful and really informative for you. So of course, kind of the purpose of the analysis and the assessment that we did was to be able to get some information to better position ourselves to understand and improve policies in Utah that affect healthy communities. So Alicia, if you want to go to the next slide. And I realize that I'm probably preaching a little bit to the choir here, but I do think it's valuable just to take a couple of minutes to lay the foundation for why this is important and why policy matters. So of course, we know that health is impacted by access to resources, the built environment, and that policies are often what drive that. And so often it's upstream policies that fuel a lot of the health disparities that we see across different groups today. And so policy level change can be a little bit tricky because it does require high levels of collaboration and teamwork across sectors to really be effective. So the purpose of this analysis we did was to analyze the health policy gaps and needs in the state, and then get some information that will help us build the capacity of the public health workforce and other state leaders to enact change. And so, of course, we know that the more upstream we go with our solutions, the more people will be impacted and the longer lasting the changes and the impact will be. And so with that, what we did is as Get Healthy Utah, we received a 2-year grant from the Utah Cancer Action Network to work on strengthening the public health workforce and being able to better affect policy. So the grant objectives for year 1, there were 2 things that we said we would accomplish and that we did do over the past year. So the first one was to survey the policy needs among the public health workforce to better determine their strengths, needs, barriers for employees engaging in policy work. And we did that in a survey and through some key informant interviews, and that's what we're doing today is presenting on the results of those findings. Now, what we also did, and we'll talk about this a little bit more at the end of the presentation, is that we also partnered with the Utah Foundation to conduct a policy analysis to kind of do kind of like a landscape analysis to understand what policies currently exist in Utah that affect healthy and active lifestyles, as well as access to healthy food. And so I'll save that again until the end for Alicia to go over that a little bit more. But we were hoping that through this kind of landscape analysis, through both surveys of employees of the public health workforce and the work that the Utah Foundation did, that we could really set up ourselves well to start making a difference and addressing the needs that we found. So if you want to go to the next slide, Alicia. So you can see we did finish that report with the survey and the key informant interviews. If you want to access that, you can find it at any time on our website. All you have to do is go to gethealthyutah.org. At the top, we have a tab that says what we do, and there's a drop-down menu that says research reports. And if you go there, you can access and download the report at any time. And so again, just to kind of go over what we did. So the survey, we sent it out through a lot of different channels, trying to get input from all of the different public health workers across the state. And we did get 122 responses. And we were pleased to see that it was kind of a statewide response that we got. And then also we held key informant interviews with 12 different individuals. And so you can see on the right-hand side, some of those organizations that participated in the interviews. We had the American Heart Association, Bear River Health Department, United Way of Salt Lake, the Utah Association of Local Health Departments, Utah Public Health Association, and the Utah Department of Health and Human Services. Just to protect privacy, we won't say who we interviewed at those different organizations, but hopefully it is helpful to see where those key informants were coming from. And then in our report, between the survey and the key informant interviews, We did a lot of coding, a lot of analysis, a lot of breaking down the data that we got, and we kind of condensed the information into 9 different themes, which is what we'll be going through today in the presentation. But the 9 themes that we'll be talking about is policy priorities, collaboration, general attitude towards policy work, future efforts, level of policy, facilitators, barriers, policy needs, and the idea of creating a statewide public health policy group. Oh,
All right, going the wrong way. Okay, so with our survey, we did get 122 total responses, and you can kind of see the breakdown of the responses. So most of our responses, I'd say the majority came from public health professionals working at either the local health department or the state health department. We also did get some responses from universities and colleges, from healthcare systems, and then a handful of responses from some other areas, nonprofits, and so forth that you can see there. So kind of like a good variety of responses between the different sectors. When we asked how long have you worked in public health, again, we got a good variety. A little less than half were newer into the career, 1 to 5 years, and a little over to half have been in public health for over 5 years, and you can kind of see the breakdown. And so again, this helps us kind of see that we're getting a variety of perspectives across the public health career. We then ask how, if they do engage on either as an employee or an individual, and you can see here kind of flip-flop. So as an employee, about 60% do engage in some type of policy work, and then as an individual on personal time, about 40% said that they are involved in policy work. As we drill down into the organizational level, again, we asked, is your organization currently engaged in policy work? And the majority of people said yes. We did define policy pretty broadly. You can see the definition here on the screen. It wasn't just working at that state legislative level, but all the way down to organizational policy. And so when we included that broad definition, I think a lot of people felt that they did something at some level when it came to policy work. And so these are the areas we offered for them to choose in terms of what areas does your organization do in policy work. So you can see the majority either chose healthy communities and environments, chronic disease prevention, mental health access, and suicide prevention. As I was reading through open-ended responses, I realized I didn't pull out tobacco and substance use as one of those topic areas, but I did see a lot of our public health professionals working in the tobacco and substance use space fill out the survey. So I think if we would included a separate category with tobacco, we'd see a lot of our public health professionals. And I think we have a lot of traction with our tobacco and substance use area. And then policy-wise or level-wise, when it comes to policy, we can see the majority work at local level policy, organizational, but we do have a good amount doing state, regional levels as well. And then this was an open-ended question. I just copied a few things from the open-ended question so you can see what are people doing across Utah when it comes to policy work. And so we can see, again, tobacco was mentioned a lot in this question. So working on tobacco policy in schools, healthy school initiatives, working with lawmakers to helping them understand the impacts of health, collaborating across coalitions, whether it was a Communities That Care coalition or other type of coalitions, and doing some policy and advocacy work through those coalitions. It was great to see, some of the efforts of having dinners and doing Capitol Day on the Hill work, talking to legislative and leaders. And then other examples are working with childcare centers, with clinics, with community members, reading and tracking bills, and then local research and looking at our research and then sharing that research to policymakers. So these kind of gives you an example of what we're doing across Utah.
And so we also asked during the key informant interviews some deeper questions about what are you doing for policy, what level are you working on? So as you can imagine, having about 12 different interviews, each of them about an hour long, that's a lot of information. So what we've done here for the sake of presenting the findings of the report is after coding all of those interviews, these bullet points here are just kind of the most salient points that came out of all of the interviews and kind of a summary of the themes that we found. So I'll just go ahead and read those. So one thing that was noted is that passing a local level policy is often a really effective way to provide momentum for passing the policy statewide. And so a lot of the people who are working on local level policy, that is kind of an end game goal, is that hopefully the local level policy changes that they're enacting can spread throughout the state. Another key point was that key players and networks differ across local, state, and federal policy work. So depending on what type of policy you're working on, your strategy and what kind of help you need might change. Then regardless of the level of policy work, it is valuable to obtain public support and community involvement. I think we would all agree with that. And then many organizations do have a formal process regarding what policies they will and will not support, regardless of the policy level. So if we go to the next slide, just some direct quotes that help support some of those things is if you look at that third bullet point, it says the process is the same whether we're looking at a piece of legislation, whether we're looking at a statewide policy or departmental policy, we kind of do the same thing. We review the policy to determine if it's needed and what the cost benefit ratio is. Then we decide if we're going to move forward with the support of the policy. So a lot of times leadership in different public health departments are often the gatekeepers determining whether or not an organization or employees will engage with a certain policy. So another thing that we asked during the interviews was we asked them about their policy priorities, what they care about, what they're focusing on. And so as I'm sure you aren't surprised, a lot of the high priority areas across public health include health equity, the social determinants of health, and public health funding. And then an organization's missions and goals determine which policies employees can invest time and resources again, kind of the leadership and the mission gatekeeping there. Then effective policy work includes passing new policies, strengthening existing policies, and defending against detrimental policies. And then legislative priorities change yearly based on which policies have momentum. So if we go to the next slide, just some quotes about that. You can see there on the bottom, we have a policy agenda and it's a huge list. I think it's just one of those that you try and prioritize and put your efforts to where you feel like it's going to be best served. But in the long run, you might have one policy that all of a sudden becomes important because the timing is right. And then another thing, just the quote right above it, is sometimes the work is to strengthen a policy instead of pass a brand new policy, right? Maybe there's a policy already there, but now you can add to it and strengthen it. So again, not only creating new policy, but strengthening existing policy, defending against bad policies, and so on.
So the next few slides are about the attitudes towards policy, and both of us working in public health, we kind of had our own attitudes, you know, with coworkers over the past, kind of knowing how people are feeling about policy, but we really wanted to do it through a survey and see how are we truly feeling in Utah when it comes to working in policy. And the results don't surprise me, or I think probably many of you, is that we feel that policy work is very important, but we do not have the confidence to do it. And so you can see here in the graph, we asked from very low to very high when it comes to importance, to confidence and interest. And you can again see that importance is really high, but when you go to that middle, confidence, we don't have a lot of confidence when it comes to policy work. And that can be for many reasons. And we'll kind of talk through some of those barriers. So starting with the positive, facilitators of what has worked well, and you can see here, the most significant facilitators included focusing on relevant data and stories when we do policy work, having that narrative that we can share with policymakers, building partnerships. We know in public health, collaboration and partnerships is key, and having different coalitions, as was mentioned, and different task force working together has really been helpful. And then having that leadership support and buy-in. Again, our leaders and our systems and policies dictate how public health workers can work in the advocacy, education, and policy space. And so having that leadership in that direction is really critical to public health professionals working on policy and advocacy. For barriers, the most significant barriers, we did a scale. So again, they can put not a barrier all the way to a significant barrier. Because again, we felt like we understood the barriers that are in public health policy work, but wanted to really understand how much of a barrier it is. So the highly rated barriers was political climate. Again, not a huge surprise coming out of the COVID pandemic and the kind of politicization of public health. So political climate right now, lack of resources, whether that is time and staff or money and funding, not allowed to, and grant restrictions. Again, I think this is a space we can look into, how we're talking about policy work and advocacy work. The message right now is that we can't do a lot, but I think that can shift, that there is a lot of space for us to work when it comes to public health policy and advocacy work. And these restrictions might not exist as much as we think that they do. And then again, that lack of personnel.
And so when we asked key informants just to talk to us about those attitudes towards policy, the biggest things that came out is that, just like mentioned, public health professionals feel that policy work is important and can have a large impact on the health of populations. There was a lot of enthusiasm for policy work in our interviews. However, many professionals shy away from policy work out of concern that they cannot lobby. There's a lot of fear there in getting in trouble or doing something wrong. Then barriers to engaging in policy work include legislative fatigue, burnout, insufficient training, and low support from leadership. And legislative priorities change yearly based on which policies have momentum, like we talked about earlier. And so just some again, quotes to support that is that first one is, I love talking about policy. It's going to have greater impact than some of the things that are easier to do than just have a smaller impact. I think it's fantastic. Then the next one is, a lot of them are scared off from doing any work at the Capitol or just any policy work because they think, well, I can't do this because I'm not allowed to lobby. But there is a lot that they can do that I don't think they necessarily think about sometimes. And then the next one is, it's a very long process that can take a really long time. People get burned out, people leave, a lot of people lose steam. And then the bottom quote there, it's a little bit longer, but I think it's valuable. It says, how do we get our programs and our managers excited about policy work? So they're excited, but not deflated by the red tape that is around them and the experiences they've had in the past. I think that's just, I think that's really just critical, having upper level leadership really saying policy is important to improve health and well-being. And so we asked them again, what are some facilitators? What's really helpful when it comes to engaging in policy work? And so some policy tools that they pointed out that they really appreciate are bill trackers, model policies, one-pagers, talking points, and data aggregated by legislative district. They all mentioned, this was a pretty strong theme, especially with tobacco, that legislators are universally motivated by protecting and supporting youth. And so using that as the narrative when approaching an upcoming policy you want to champion can be really motivating for legislators. And then strong relationships with legislators and decision makers greatly enhance policy work, and public health workers are valued as content experts, and resources for data. So again, I think it's helpful to contextualize a policy in a 1 or 2 pager, basically like a policy memo. So he, meaning a legislator, can see it outlined. I think that's something that's really helpful. So being really visual in how we present our data. And then model policies are super helpful. If we can provide some model policies as well as the bill tracker too. So not just the bill tracker, model policies. And then let's see, I think I do like, because I don't want to take too much time reading all of them, but second from the bottom is we do meet with legislators pretty frequently. Like during the interim session, we try to stay in contact with them. And then one thing that was mentioned as something really positive, how public health can help support policies, is we will very frequently get requests from senators or representatives asking for draft language. And that gives the department and I the opportunity to provide that. We can't proactively send it out, but if they ask us for it, we can. And again, that is based off of an existing relationship with legislators. So some challenges and barriers. Of course, that red tape that restricts public health officials from engaging fully in policy work. Also, Utah's legislature is not expert in public health, and the political climate is often unfavorable towards public health, again, especially after COVID-19. And we don't have a lot of, you know, as the layperson legislator, we don't have a lot of people with experience in public health. Then public health is, of course, underfunded, while political opponents are often well-funded. and policy is slow to change and can be opposed even after being successfully passed. So it's not just a one and done, check it off. So some of the quotes, and this was a really common attitude that we came across, is if the governor doesn't support something, we can't speak about it publicly, so there's red tape. So it almost felt like, so that's our dead end, we can't do anything, rather than necessarily creatively thinking about ways to still promote what's important. Another thing is we're faced with a lot of identity politics right now, and that makes public health really hard. We all realize that. And then another thing is that I think it's important to remember how much money, again, a tobacco person, but how much the commercial tobacco industry has and how much money they put in towards lobbying and all of that effort to undo work that we've already done. So I think that's a challenge or barrier, making sure that people understand that it's a constant battle about making sure we're not losing progress that we've already made, as well as attacks on our data sources.
So this is an open-ended question from the survey. So we asked, what resources or changes do you need to engage in policy work more effectively? Out of 87 total responses, we kind of put from most responses to least responses, the themes that came out of this open-ended question. So the top response was needing more knowledge and training. Again, getting to that, we know it's important, but we don't have the confidence to do it. And so some quotes from there include, I think an understanding of how to do this and that it is possibly not as overwhelming as one might think. And I think that is a sentiment that we have, that policy work's too hard, we don't know what to do, what we can and can't do, and so we don't engage in it because we don't have that confidence. We need a more skilled workforce. Public health educators shy away from this work. So again, what can we do to infuse that confidence into our public health workforce so that they feel like they can make a difference in this space? Second was needing more time and staff. Again, time is the biggest barrier. Unless it's funded or is part of a grant, then it's put on the back burner regardless of how important it is. So again, looking at what we can do with our funding, with our grants, how we can prioritize and put some time into working on education, advocacy, and policy work. More funding, again, kind of ties to the grants and funding piece. That's a huge barrier. Needing more leadership support. Some quotes from that include, leadership needs to take the lead and they need better training. Educating about policies is not lobbying. And my role as a state employee is limited and feels even more limited than what is legally allowed. So again, kind of understanding what culture do we have in our different organizations that work on public health, what is leadership doing and training, and kind of what is the language and communication from our leadership when it comes to engaging in policy and education work. And then the last few were needing more support and partnerships, again, trying to be strategic and look outside at our coalitions. Who else can we engage from other sectors that can help us move forward on policy that might not have as many restrictions as some of our organizations have? And then having more resources and information, having those guided direct actions that we can take, having data and showing potential impact of policy change. And then the last one was just kind of having the means for data. Oh, that kind of doubled it. Anyway, but having that narrative, we talked a lot about public health has great data, but being able to put it in a way that is more of a story, more of a narrative for our policy and decision makers to understand and realize the importance of that work, and then how that's going to impact overall well-being and quality of life of Utahns. And then this is another open-ended question. We asked, when would your public health work have benefited from policy level changes? And here's just some of the responses of examples of thinking, when could policy have made a difference? And so the first one talks about active transportation, encouraging employees to walk instead of use their car, but that our organization can't tackle these projects alone, and they must rely on policy level changes for that infrastructure and funding piece for infrastructure. Another thing was getting policy about resource referrals, healthy schools, onboarding, training about health equity at our own organization, so internal policies and what we're doing internally. De-identified data from clinics for health departments. We know that's something that we've all wanted to work on and continue to work on. Some policy related to tobacco and flavored vape, getting rid of that. A sugary drinks tax could help with obesity prevention. one talking about research that has been done around childhood adversity and getting that research into the hands of policymakers and informing policies with that research. Then the last one is having standard operating procedures for implementing policies. And I thought that was an interesting one. And I'm curious to know if organizations have standard operating procedures when it comes to advocacy work and policy work.
And so again, going back to those key informant interviews, a lot of the policy needs that were identified revolved around professionals' need training about how they can effectively engage in policy work, and they benefit from specific action steps rather than just training in general, right? Rather giving specific tools to help them take that next step. Then public health needs to get better at storytelling and translating data for the needs and interests of decision makers. And then public health infrastructure and funding needs to be improved to support effective policy work. And so one of that very top quote here says, help staff just understand the difference between what is advocating, what is educating, what is lobbying. That conversation that we always have to have in the realm of public health. And I might add having more than one conversation about that, right? It can be a pretty nuanced thing. It can be a little bit hard to understand. So I think repeatedly talking about it and building that confidence so that people aren't, don't feel like it's a gray area and aren't even willing to travel into the gray area. One thing that can be really helpful is kind of mentoring, right? So one person said that their skill in policy work was really built when they started going to the Hill with them, meaning their mentors, and kind of learning the process. It was only because there were so many great people that helped me, that mentored me along this way, that they ended up getting as confident and influential as they've become. And then again, we've got to get better moving forward at telling our story. That came out quite a bit in a lot of the interviews that we did. So just reading that next quote, because it leads into that really well, is we need to remember that legislators don't have a ton of time. And sometimes we try to convince them of how important a cause is with pages and pages of data and information. But the more succinct we can be, and if we can share more of that personal aspect, give it a face, then we can go further with that. So remembering that when you talk to legislators, they aren't going to remember the data, they're going to remember the faces. And so as public health, we really need to champion the individuals behind why we want a policy changed. And then, so moving forward, we also asked about some things that can be potentially helpful, right? And so one of the things we asked about is collaboration. And so, of course, this might, seem pretty basic to us, but it is still profound. Effective partnerships can often be found across non-traditional sectors. Coalitions are an effective way to connect partners and organize policy work. Those who will be disproportionately impacted by a policy should always be given a voice. And barriers to effective collaboration can include a lack of time, resources, and professional bandwidth. And again, some of those quotes is, and this is referring a little bit to some policy work that was done during COVID-19, but the reason we got those bills staved off was because of the business community and not because of public health. And that, I think, was a really big eye-opening experience to me, that there's a lot of correlations between a strong business environment and a strong public health response. And then another quote is, we have a coalition, that is where we get into the lobbying advocacy part of it. So they're able to do more actual connecting with legislators, connecting with our other partners. So even if an individual might be limited on the exact extent of lobbying they can do, doesn't mean they can't still be part of a coalition where other people are actively lobbying. And then I like the last quote. It's really about getting the right champion to be able to propel it forward. And I think that's one of the things that can be beneficial with collaborating. It has to be a collective effort, no matter what. And then asking about future efforts. In the interviews, we asked what they're intending to do, again, in the future regarding policy. So many organizations that we talk to are in the process of increasing their partnerships and updating their policy agendas and strategic plans. That was a common theme, like, oh, we're revisiting our strategic plans, we're revisiting our policy agenda. And then public health professionals are striving to expand their data sources, improve their storytelling. Again, people are cognizant of that now and working on it, and better engage community voices, sorry. And then upcoming innovative efforts include organizing a health equity institute and organizing youth councils. So a quote here, one new thing that we're hoping to do is to develop an office level policy agenda. And I think that the hope is that it'll be informed by our engagements. Where do we have support across different programs and partners? Another quote going down on the white, we're really going to focus in on the storytelling, story collecting, and trying to find where the missing pieces are related to how to empower and support community-based organizations to be part of these larger policy conversations that may not be as easily involved. And then about the policy, the Public Health Institute, there's a quick quote there. And then the last one is we're starting a youth leadership council. We're trying to get more high school students right now. I think it's a lot of college age folks that they've been able to recruit. So again, recognizing that our legislature genuinely cares about the youth and getting them involved in public health policy work early on can be very valuable. And then the second half of our grant with the Utah Cancer Action Network is organizing a statewide public health policy group. So we took this as an opportunity to ask those we were interviewing what they thought of that idea and what they felt like would be really important for that to be an effective policy group. So the response was that most organizations were supportive of organizing a public health policy group, but may not have the bandwidth to take on a leadership role within it. Potential challenges to be aware of in organizing it include competing agendas among group members and a duplication or redundancy of efforts. And then just the emphasis that the group would need to have a clear direction and concrete goals and action steps to be effective and worth members' time. So again, just a couple of quotes about that. Is the top one, I do think that it's a great idea to put something like this together. The successes that we've seen from groups and coalitions that we've had that would operate very similar to this, I think it's really powerful. The next quote down, having that coordinated approach would be beneficial and helpful because policy doesn't happen in a vacuum. It has to happen with everyone working together, and the more people that work on it, the more likely that you are to get it to pass. But on the flip side, if you have too many things, then you don't get anything done because you've got competing, well, this is my policy, this is yours, and then it just doesn't become helpful. And then the last quote I'll read is the third one, making sure it's not a redundant effort because a lot of times everybody in the nonprofit space, they've got too much on their plate and not enough time.
So we also asked this in the survey to respondents. And again, most people were supportive of looking into some type of policy group. And we asked if we were to create a policy group, what efforts would you find most helpful? Again, the education training part, we're pretty high up, but also making sure we educate the public health workforce on what current policy efforts are going on. Again, not to duplicate efforts, and then support organizations in their existing policy work. And then we did have an open-ended question as well, asking what efforts would be most helpful. Again, that list of themes on the side, the training, funding, staying informed, having connections, highlighting successes, coordination, a space for your voice to be heard, and leadership support. And a few quotes that we pulled out on the right-hand side, training for elected officials on prevention, how to look at data, working with us to create a list of subject matter experts based on the topic that can be called upon when needed to present to the committee, assist with media requests, or rule legislative writing or testimony. And then bringing together and coordinating all the different groups that are working on these efforts so there's not a duplication of the efforts. Key takeaways overall from our report, again, is that public health professionals in Utah feel that policy work is very important. However, they feel heavily constrained by red tape, a lack of confidence, and limited time and resources. So needs and recommendations overall as a summary is to increase policy knowledge and training opportunities, increase funding, time, and leadership support for policy work, provide tools relevant for influencing policy change, and improve opportunities for networking and partnerships. And we do know groups already exist that work on policy, and we have a lot of coalitions that are topic-based, like the Tobacco Coalition Group that work on specific groups. And so those exist and are opportunities for public health professionals to tap into. And then I sit on the UPHA and USOFI's advocacy unit. And so we know UPHA, Utah Public Health Association, and USOFI, Society for Public Health Educators, also does advocacy work in the space of public health policy. And so that's another opportunity for public health professionals to get into UPHA or USOPI advocacy efforts that's more broad public health policy work. Get Healthy Utah, our mission is focused on healthy eating, active living, and mental well-being. And so as we were talking about a public policy group, we are really looking more on our mission and when it comes to healthy eating, active living, and mental well-being. And so it again is not to duplicate efforts from UPHA, USOPI, or other groups, but kind of filling a space in the mission area of Get Healthy Utah and see where we can make some traction in those specific topic areas. So I want to take a moment to talk about the Utah Foundation analysis that is, again, with Get Healthy Utah's mission. We wanted to partner with the Utah Foundation to create a report and analyze policy and strategies when it comes to active living and healthy eating, and be able to distill it down and provide reports and briefs and memos for decision makers across Utah. Again, partnering with a non-public health entity to also be our voice and champion when it comes to these policies and strategies to improve healthy communities. And so they have a healthy communities report that they already have 2 that have been released. The one that we worked with them on is the Advancing Wellness and Safety Report that was released in June of 2023, and you can go to their website to get that full report. And then the second report we worked on is the Food Accessibility and Quality for Utahns, which is anticipated to release in September. And so again, these are opportunities for us to get these policies and advocate for these changes for local leaders, state leaders, when it comes to healthy eating and active living. So the report that was published in June, they had a table of contents. You can kind of see just a quick snapshot of what was included in the report. So that you can see the potential projects and policies, and then they put what was the goal area, what's the actor, who is involved in that strategy, the cost, and the benefit. And they had a formula for these different things. So you can see here, we included strategies and policies around health and all policies, park and open space, zoning, park culture, bikes and trails, enforcement, complete streets, road calming measures, and economic development. So a widespread, again, of different policies that we can share with leaders and talk about that we know improve public health and community health in our communities. And then a few policy highlights that were shown in the report from the Utah Foundation is that community leaders should consider centering health in all policy making. Again, going to that health and all policy framework that Get Healthy Utah piloted with a few cities this past year. Looking again into increasing land use for active living, physical activity, and evaluate zoning reforms. We know that the built environment is hugely impacting our ability to make the healthy choice a default choice. Calling out building and maintaining trails and the safety aspect. And then they talked about enforcement as a safety piece using photo radar, implementing complete streets, and then active transportation plans. So those are a few highlights from that report, again, that you can utilize as an arsenal when working with local leaders on some of those decisions and strategies. So we are in our 2nd year of our grant with UCAN, and we are going to start working on getting together a public health policy group, again, more aligned with the mission of Get Healthy Utah and those areas that we are working in, look at a policy plan, and then some type of post-survey. We do know that some people in the survey put if they were interested in the policy group, we're going to start reaching out and probably start small at the beginning with some advocates and champions in this space and figure out where we're going to go from there. Again, we know that we've had a lot of successes with policy and advocacy work in some of our areas of public health, like tobacco, that we want to replicate and learn from them and see how Get Healthy Utah can help be a partner when it comes to improving our confidence and figuring out best ways we can have a narrative to push forward great policies and strategies here in Utah to improve public health. So that's the end of our presentation. We did want to take a few minutes for any questions, and then we had a few questions for you, a few discussion questions to get feedback from you all on your reaction to the results in the report. So I'm going to stop sharing my screen and first just take a few minutes. Any questions or comments that you want to share, you can either come off mute or put them in the chat. Okay. As you're thinking, if you do have questions, we did have a few discussion questions just to kind of get we released the report in our newsletter last month, but we really haven't been able to get talk with people and present on this report. This is our first time presenting on it, so we wanted to get some feedback. So our first question to you, again, you can either put it in the chat or come off mute, is what resonated with you from this report? I know Morgan and I had things that we, weren't surprising. So we wanted to kind of see how others felt, what resonated with you. Again, you can come off mute or put thoughts in the chat. Got a quiet group. Okay. The other question, if you don't have an answer for that one, is what surprised you from this report? So either what resonated with you or what surprised you. So if Ivy, looking forward to learning more about policy group. Yeah. And I'll throw our final question in just because it seems like a very quiet group. If you have thoughts, the last question we had, any other thoughts on future action steps, whether that's from Get Healthy Utah and the role that we can play, or other organizations on how we can move forward, improving our advocacy policy work here in Utah. So if you have any thoughts on any of those questions, we would love feedback. Again, you're welcome to come off mute or put it in the chat. And then, another comment from Ivy. It's nice to have what we suspected documented in a nice spot. Yeah. And I think that was really one of our intents here was, we hear the facilitators, the barriers, the issues with working in this space, but really having this down. We hope to give this out to others. So we did send it out on our newsletter, but reaching out to leadership in the local health departments. If there are other ways for us to send this out and get the word out, or other formats, again, we have the longer report version, but we can look at other formats to get the word out on having this documented and be able to use some of these suggestions and recommendations, not just for us and our work at Get Healthy Utah, but for all organizations and all topic areas when it comes to public health. Jamie says something that resonated is just the fact that other areas experience similar barriers as we do, and I appreciate the work that you are doing to identify needs statewide regarding health policy work. Thanks, Jamie. We'll give a few more minutes for any thoughts in the chat, or if you want to come off mute. Ooh, Chris, you'll be presenting this to legislative bodies. That is a great thought. We hadn't considered that yet. I know our first step was doing this policy group, but I think that's a great idea we can include as a potential next step as well. Again, we will be sharing this recording and the slides, so we'll send that out in another email. And again, I know there's some that couldn't join us live today, so we'll send that out. And then you are welcome to forward this on. We'll probably post it to our website. We do have the report on our website, but we can post the recording as well. And then just encourage you to forward this on to others that you think would benefit from this information, or if there are connections to Get Healthy Utah and our future policy work that you think would be beneficial, please let us know. We're always wanting to reach out and collaborate with others. So not seeing any other chats, we'll go ahead and end a few minutes early. Thank you all again for your time and attention, and we look forward to working in this space. Thank you so much. Bye.